Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about brand new developments in breast augmentation and breast implants. Later, we'll be taking your calls, answering any questions you might have. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, you'll certainly want to consult your own physician as well. Welcome back to the program, Dr. Mele. There's big news in the breast implant world. The FDA just approved something new?
They recently approved what we've been calling the gummy bear implants, or high strength or highly cohesive gel implants. It's been something I've talked about a few times on the show before. It had been going through FDA review, and FDA review finally came through with approval earlier this year, and now the implants are actually available. Okay,
we're looking at the old-fashioned gummy bear implants.
Yeah, well, originally there were saline and silicone gel-filled implants, and this is kind of a third type of implant. It's still a silicone gel-filled implant, but the gel is polymerized, so it's more viscous, it's stiffer, so it's not that it feels hard, but if you were to cut it in half, the gel doesn't leak out.
Okay, so the new FDA-approved breast implants, what's the difference? The
way that the gel inside is made, and it allows us to do something we couldn't do before, which is enforce a shape on the implants.
Okay, you have some examples here. Let's go ahead and pull them out.
So we have a couple examples. I mean, this is a shaped implant. You can see that the one side is larger than the other, so this would be the lower half.
And that's a more natural shape, because
it is.
Women's breasts are not all perfectly round.
Sure, sure. And if it's someone who's flatter to start with, then that's an advantage. For someone who already has all the breast tissue at the bottom, may not be, and a round implant may still be the best choice. But you can see there's a little line, a register line, to make sure we've got this rotated correctly, and then the dot shows us where the high point is. So if we look at it sort of on profile, we kind of want that to be behind the nipple, and the upper part would be more tapering.
Okay, why wasn't this done before? I mean, this certainly replicates a natural breast.
Sure, it's a great question, and actually the first breast implants that came out 50 years ago were shaped implants, and they were more viscous than the later silicone gel implants. The problem with them was, in order to keep orientation, they had two little patches on the back. They were Dacron patches, sort of like the fuzzy part of Velcro. So the body could grow into that, keep them from rotating, but it formed a stress point. So where the body, when the body moved, those patches stayed still, the implant would fold at those points, and it just made it more likely to leak.
Okay, I mean, what's the chance of this thing rotating and then, you know, the wrong
There's a
size?
small percentage. In some studies, it's listed as high as 10%. It varies with the type of texturing. The more highly aggressive texturing, the more bumpy it is, the less likely it is to spin.
Okay, we want to get into that because you want to really look at how it does attach to the body and how it manages to stay in place. But I mean, this may seem like an obvious question, but are there advantages to the natural shaped ones as opposed to the rounded?
There are, and probably the biggest advantage is going to be in the field of breast reconstruction. So for women who've had a mastectomy, there's really no breast tissue there, because it's all removed to prevent cancer from coming back. And the skin at the bottom of the breast is tightened because the nipple and the lower half of the breast, that skin's been removed. So when we put a round implant in there, it becomes sort of a space filler that depends on the skin to give it shape. And usually it's tighter at the bottom than the top, so we end up with a sort of an upside down looking breast. Whereas with this being stiff, with time this is going to push the lower pole out a little bit further and give us a more natural appearance and a better look.
Okay, well, with what we see in some of the magazines at the supermarket, you know, you'd think that maybe some people don't want a natural look, that actually this sort of
Sure, and this would not be a good choice for them. For people who want that really round look, then this would be kind of defeating that.
Okay, but I mean, are there disadvantages to this? Certainly it's new on the market.
Sure.
But it has been tested by the FDA.
It's been available in Europe and in South America for more than a decade. And the FDA took its time in getting through the approval process to make sure that it was safe and effective, and that the study showed that it did what the manufacturer were promising, especially with what happened in the 90s when there was so much controversy, even when, as it turns out in retrospect, a lot of the problems that were said to be caused by gel implants turned out not to be true. We just didn't want to go down that road again. We wanted to be sure it's safe before we offer it.
Okay, well, if we open that Pandora's box, I mean, the controversy being the silicone leaking.
And a big part of that leaking was it was a much more liquid-like silicone. It could travel underneath the skin. It could cause lumps in the armpit down underneath, whereas this is much more cohesive it's not as likely to do that.
Okay, we need to take a quick break, but for more information about Dr. Mele, you can call him 925-943-6353 or check him out on the web at either drmele.com, sanfranciscobreast.com, or even at San Francisco Plastic Surgery blog.com. You're a busy guy. We'll be taking your phone calls and show you some before and after pictures when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.